Receiving the Brendan P. Kelly Award is deeply meaningful to me for several reasons. When I was a young assistant program director, I looked forward to coming to these yearly national meetings with MPPDA so that I could learn from the people I looked up to who are also in this APD role, people like Brendan Kelly. This organization taught me and so many of us what it means to be a leader, and it showed me the value of mentorship. MedPeds educators are known for being collaborative leaders and compassionate mentors, and Brendan Kelly was one of many who made that the case. When I think about Aptum and APPD, and especially the MedPeds Program Director Association meetings, I can think of countless workshops, talks, hallway conversations at these meetings that have had a deep impact on me and the way that I approach this role of being an APD. I know that's true for scores of others. And when I think about the scope of our collective impact on the physicians we're training, I'm really inspired by the power of our professional community. So this award fills me with appreciation for the community of educators who've shaped me, including Dr. Kelly, who continues to be very much missed. Being an associate program director for the past 15 years has given me a close view to the growth and development of a generation of incredible physicians. And the many years of supporting and mentoring them have carved me into the education and mentor that they needed. Having close proximity to the courage and commitment of residents can fuel the flame of our own love for patient care and for teaching. And I love nothing more than to watch residents become who they are fully capable of being. It's been a privilege to advocate for them and to invest in making the educational environment safer and more compassionate and more sustainable. My conviction is that medical training is one of humanity's most formative experiences, and that it is absolutely possible for us to make it both humane and excellent at the same time. The 15 years of MedPeds physicians that I have mentored, along with so many others, are proof that our profession is in good hands for the future. I'm so grateful and proud to be a part of their lives and to try to have an impact on their profession as a whole. This award is also meaningful to me because it was my own APD in residency, Dr. Walden Garris, whose investment in my education and growth inspired me to pursue a career in academic medicine and pediatrics. He's still someone to whom I turn for advice years later. My program director, Dr. Sandy Muchis, has also been a longtime support and has provided strength and a listening ear during several difficult seasons. I also want to acknowledge Dr. William Stone, who taught decades of residents like me that excellence and compassion are necessary partners, and who also role modeled that a life in medicine is a lifelong chance to learn and grow. And he had the confidence and security to inhabit the educational space as his unique self, choosing to send out his own daily poems at a time when that was unusual, while simultaneously holding all of us to a very high standard of clinical care. But the most important people for me to thank are my colleagues, current and past, in leading the Mass General MedPeds Residency Program, alongside whom it is and has been a pleasure to work, including Dr. Evangeline Galvez, Dr. Meredith Eichen, Dr. Madeline Matheson, Dr. Jing Ren, and Dr. Michael Kelly. My husband, Dr. Aaron Hata, shows me an incredible daily example of steadiness and a love for attending carefully to the small things that are necessary for excellent, beautiful work. And I want to close by acknowledging that it is our residents and our patients who are the point of all of this learning and work that we do. And it is such a privilege for all of us to serve them. Thank you.